Imagine if you could study for half the time others do and still get the highest grades. I'm Salim, I've done an undergrad and postgraduate degree, and now I'm a final year med student. So I've spent thousands of hours in studying and figured out the best way to use my study time so that I can get the highest grades as efficiently as possible and still have time for other things in my life. So I'll go through the most important things that can help you do this too, and the fourth point alone saved me about 10 hours of studying a week and helped me go from a B grade to an A+ almost straight away. So first, I have a question. Did you click on this video hoping for a complicated and detailed guide that's going to magically make your studying 10 times more efficient? Because if so, that's not what effective studying is about. What I've noticed with every high-performing med student is that they don't have a complicated study routine, because simple works best. The idea of keeping it simple is to minimize how much effort it actually takes to study. So using a complicated routine of color coding every subject and scheduling down to every hour of your day isn't going to help you study better. It will only work for a few days until you get tired of seeing such a busy routine. And now you might be thinking, how can you keep it simple? How can you study in a way that's both effective and sustainable so that you can get the highest grades consistently? The best way I've found is by preparing yourself with a branched system, and I'll explain what this is. This is typically a system where you limit yourself to using a maximum of 3 methods at a time, so that you have flexibility in your approach to studying. For me, the main 3 I stick to includes one for memorizing, one for understanding, and another for time management. For example, if I'm learning anatomy or memorizing simple facts, then using an active recall and spaced repetition system is all I need. But if I'm trying to understand difficult concepts, which is typical in neurology, then I'd use Feynman's technique to make sure I fully understand a topic so that I can answer any question on them, no matter how difficult. And if I'm aiming to manage time effectively with studying, I'd focus on getting through a certain amount of topics or questions a day, as opposed to aiming to study a certain number of hours. I have videos on all 3 of these things which I'll link below. Doing this gives you a small amount of flexibility so that you have all of your bases covered, because chances are, if one technique doesn't work for one subject, one of the other 2 techniques is going to help. And you don't have to use the 3 I mentioned. Try different systems out for a few weeks and see what works best for your workflow. So now I have a question for an important point. When you have an exam, what do you do to prepare? There's the saying that if you fail to prepare, then you prepare to fail. But just as important is that if you do prepare but in the wrong way, then you develop the wrong habits that stop you from getting the grades that you want. And what is the wrong way? From what I've seen over my 8 years at uni, people that prepare for exams by studying in groups in exam season don't use their time that well, which makes sense when you're with your friends. And people that also just reread their notes or watch lecture videos during exam season also don't do too well or use their time effectively. And this video is about the most efficient way to study for the best grades. And the best way to study for exams regardless of your subject is making sure to prepare with questions. In med school or with doctors and surgeons, you learn everything you need to know by doing, whether that's a surgical procedure or administering a medication to a patient. The best way to get better at them is by doing them. Doing practice exam questions gets you into the mindset of the examiner as you see the mark scheme and learn for what they look for, or get better at looking out for patterns in questions and the topics that consistently come up. In exam season, 90% of your studying should be doing questions. There's nothing else to say for this point, just do it. And now, there's something in med school that we're basically forced to do multiple times throughout the year after our hospital placements. And when it comes to doing them, we don't really like doing them because it's a bit of a chore and it gets quite repetitive. But when I've chosen to do it for studying, it's made the difference between me potentially spending 30 hours on subject to then only having to spend under 10 hours, which adds up to hundreds of hours saved across multiple subjects. And this is making sure to have a method reflection. At med school, whenever I have any mock exams, real exams, coursework or large milestones, I make sure to do these 3 things. I reflect on how they went, how effective my methods and approach was for doing them, and how I can make sure to do better in future. For example, for a mock exam, I noticed that I did well for neurology and cardiology, but I didn't do as well for pediatrics. So I reflected on what I did well for the first 2 and how I could apply it to improve on pediatrics, and also thought about why I didn't do well for pediatrics. And I found that I focused less on relevant topics instead of the core topics, and not surprisingly, I didn't do as many practice questions. As you keep going through these 3 things to reflect on your studies throughout the year, you'll become much more efficient with how you use your time, and more importantly, become adaptable, so that if you don't do well in something, you'll find ways to improve quickly. And now I have an important point. Being able to study efficiently is a small part of the bigger picture. One thing I learned from studying was that the time you spend in academics away from studying is just as important as sitting down to study. And what do I mean by this? Basically, every top student at med school doesn't just study, they don't prioritize studying over everything else, because getting the highest grade nowadays isn't enough to differentiate yourself from others. And why does that matter? Well, why do you want a high grade in the first place? It's so that you can beat your competition to get into the course or job you want. And something that top students do that helps them study better and stand out is making sure to build their portfolio. This is about doing projects that supplement your studying, whether that's publishing a paper on a topic you're interested in or working on a research project with a professor. This helps you study better because your ability to apply knowledge increases, making the time you do spend on studying more efficient. But it also helps you stand out out because it shows that you don't just study all day. You have evidence of your commitment and a show of your credibility to contribute to the wider field, instead of just focusing on a small exam that doesn't really mean anything to anyone besides you. And this adds on to the problem that you can have the right study methods, but if your ability to think is slow, it puts a brake on how much you can actually get done, limiting your potential. And especially because school or university gets competitive, being able to think faster is necessary to become a top student. So in this video here, I talk about the 6 levels of thinking from beginner to genius, and how you can reach the top level in a fraction of the time. So watch this video to learn more.